Cardiovascular diseases, also known as CVDs, is the world's leading cause of death, which claims as many as 17.9 million lives each year globally. And according to CSI, the Cardiological Society of India, our country is now the chronic heart disease capital of the world. Hello and welcome to our special feature, Listen to Your Heartbeat. In this show, we are going to talk about a heart condition called atrial fibrillation. Our goal is to bring attention to this condition to help people suffering from this and also to raise awareness so that people can make better healthcare decisions. So today, to understand this condition and the impact it has on our health, joining me on the show are four very eminent doctors. Our first guest is Dr. Anil Saxena, consultant cardiologist, director cardiac pacing and electrophysiology, Fortis Escorts Heart Institute, New Delhi. Our second guest is Dr. Vinayak Agarwal, director and head clinical cardiology and clinical imaging, Fortis Memorial Research Institute, Gurugram, Haryana. Then we have Dr. Asit Khanna, Principal Cardiologist and Clinical Coordinator, Yashoda Super Speciality Hospital, Ghaziabad. And last but not the least, we have with us Dr. Sanjeev Gera, Consultant Cardiologist, Head of Department, Fortis, Noida. Welcome to the show, doctors. So let me start by asking you, Dr. Anil. So cardiologists these days have noticed a sharp increase in heart diseases in India, and one of the most important and the most pressing heart condition is atrial fibrillation. So what exactly is this?
Yeah, so atrial fibrillation or atrial or AF as we call it is a rhythm disorder of heart. As we know, the heart is responsible for pumping blood to the entire body, and it has to beat in a certain rhythm. Whenever this rhythm gets disturbed, we call it arrhythmia. And as we know, the electrical impulse of the heart starts from the upper chamber, that is atria, and travels down in the entire heart. And sometimes when the atria do not beat in a rhythmic fashion, rather they fibrillate because there is a irregular or chaotic atrial rhythm, we call it atrial fibrillation. It can cause palpitations, and if there is a clot formation inside the atria, it can migrate to the brain and cause a stroke. In fact, it has been considered one of the important causes of stroke in elderly population. And the incidence of atrial fibrillation is increasing worldwide as the population is aging, because it is primarily a disorder of older age group.
And Dr. Vinayak, coming to you, with the increase of heart attacks, there's also strokes that have become really common these days, and not only for older people but also for young, healthy and middle-aged, which is quite alarming and scary to say the least. So how does atrial fibrillation causes stroke?
Yeah, so as Dr. Anil Saxena just said, that in atrial fibrillation, the upper chambers of the heart, which we call as atria, they're fibrillating. So they're not contracting, there is just a fibrillating activity of the atria, and the blood tends to, there is a stasis of blood, and there is a pouch called left atrial appendage in the left atrium where the clots form. Most commonly, 90% of the clots form there, and they can dislodge and go into the brain, causing strokes. And the 1 in 5 strokes which occur worldwide are attributable to atrial fibrillation, or what we call as AF. The problem with this kind of stroke is that they're not only more frequent, they're more severe, more sinister, the disability is more, the impact on daily lives, even young lives, is significant.
And Dr. Asid, who is actually at risk of having an atrial fibrillation?
Right. As Dr. Vinayak had said, the incidence normally increases with age. But the more cardiovascular risk factors you have, traditional risk factors like hypertension, diabetes, thyroid, obesity, smoking, lack of exercise, a family history, and age above 65. As age increases, as Dr. Vinayak had said, the incidence naturally keeps on increasing. But more of these risk factors that you accumulate in your life, more the chances increase in a geometric fashion. Suppose you have hypertensive and you have diabetes and you're smoking and you're fat, then the risk of developing atrial fibrillation is many, many times more than you have when you have either none of these or many of these. Now, we generally calculate the risk by something called the CHADS-VASc score. People who are interested can Google it up, they can look at it, and they will give you a point-wise breakup of how much risk you have of atrial fibrillation and the risk of having the clot and the stroke with atrial fibrillation with this type of scoring. It's easily available. There are in fact apps of it which people can have a look at.
Oh, so we can ourselves,
Assess
keep a check.
not just your stroke risk, you can also assess your bleeding risk by a score called the Has-Bled score. So you can have a general idea, but of course do not depend on it for your own medication. Do come and have a consultation with your cardiologist.
Great. And Dr. Sanjeev, so does this happen all of a sudden, or you do notice symptoms before it actually occurs?
Yeah, definitely. When we talk about awareness, creating awareness, a person should know about symptoms. So, but unfortunately, what we see daily in our emergencies or wards, the patient usually they present to us with when they already had stroke, multiple strokes, or maybe they come to us with a fall. So it is actually accidentally diagnosed, but most commonly the symptoms are palpitations, like Dr. Saxena briefed us about, and palpitations at rest or palpitations while exercising. Maybe they are associated with sweating, and sometimes the patients come to us with feeling of thumping over heart, over chest area. Other common symptoms are breathlessness, extreme fatigue while walking, or sometimes even with angina, which is actually chest pain on walking. So these are actually common symptoms, but the commonest symptom is palpitation, and most often they are diagnosed accidentally, maybe in an ECG or on Holter recording, which is actually a 24-hour ECG monitoring, or a loop recorder recording, which is 3 to 5 days or 7 days of heartbeat recording.
And also, I think another question that I have for you doctors is that with an increasing amount of stress that we all have today, so does that also contribute to this?
It does, no doubt, because stress produces certain hormones in the body, the catecholamines or the stress hormones as we call them. They increase the chance of atrial fibrillation. Okay. Definitely.
So one thing what Dr. Asit said about the risk factors, I think one thing which I'm noticing, especially in the young crowd today, is the rampant misuse or abuse of alcohol. And we know that alcohol increases the risk of atrial fibrillation and also stroke risk. So I think that's one thing which we must popularize, or tell the younger crowd that alcohol is injurious to health and it should be minimized rather than glorified, which is what is happening.
And not just alcohol, the lifestyle drugs, these so-called vaping and the electronic cigarettes and the hookah and the shisha, these new fads in drugs, they are all arrhythmogenic. Arrhythmogenic means they all produce arrhythmias, and it's not just atrial fibrillation, many other kinds of arrhythmias which can predispose to sudden deaths, which you are seeing so much more commonly now. They are mostly arrhythmic, and these arrhythmias are because of these risk factors, traditional, and these newer risk factors that Dr. Vinayak just enumerated.
And also, do we have to take care of our diet? Like, is there a special diet that we must follow so that, we can all prevent these kind of heart conditions?
Yeah, absolutely. Yeah, Dr. Sanjeev, please.
So definitely obesity, like Dr. Khanna told us, obesity is a risk factor. Weight gain, sudden weight gain, or when your body mass index is more than 26 or you are morbidly obese, then definitely risk of AF is higher. So we have to look at all heart healthy diet. Like most often we should be looking at more of vegetables, fruits, complex carbohydrates, low fat diet, and exercise is very important thing. You should be exercising daily so as to maintain ideal healthy body weight, so that we can reduce the risk of atrial fibrillation.
And Dr. Anil, coming to you, how different is atrial fibrillation from the other cardiovascular diseases? You have a variety of CVDs, right? So
Yes,
how
yes.
different is this?
So we have arrhythmias, which are basically irregular heart rhythm, which can be from the upper chamber, like one of them is atrial fibrillation, and they can also be from the lower chamber, which are even more dangerous, like ventricular tachycardia and ventricular fibrillation. The other CVDs are like coronary heart disease, and we have congenital heart disease, which is defects in the heart by birth, and we have valvular heart disease, which basically is a defect in the heart valves, which regulate the flow of blood within the heart. So there can be a number of cardiovascular diseases, but today's discussion, of course, is on atrial fibrillation primarily, so we are discussing that.
Yeah, and how often do you come up with patients suffering from atrial fibrillation?
It is actually the most common arrhythmia. So if you want to look at incidence, it is in about 1 to 2% of population as a whole. But if you look at people above 75 years, it would be as high as 5 to 6%.
Well, on that note, it's time for a short break. You're watching our special feature, Listen to Your Heartbeat. Welcome back to our special feature, Listen to Your Heartbeat, where we are in conversation with 4 very eminent doctors, and we are discussing one of the most pressing medical conditions, atrial fibrillation. Welcome back on the show, doctors. Now, Dr. Vinayak, before the break, we spoke about, we understood, what atrial fibrillation is all about, and we've also got to know that, it also contributes to people having stroke. So, how can we reduce the risk of having a stroke?
So I think that's what we were talking about, is the public awareness. We must understand that just like coronary artery disease or many other heart diseases, like heart failure as such, atrial fibrillation also has common risk factors like hypertension, diabetes, smoking, high cholesterol, lack of exercise. So a lot of people are obese, have obstructive sleep apnea where there are a lot of snoring in the night, a lot of alcohol intake which is happening nowadays that we see. And because of all these risk factors, there is an increased incidence of atrial fibrillation. And one of the major things that we talked about was age itself, that higher the age, the older you get, the more risk is accrued. But in India, we're seeing more and more young crowd getting atrial fibrillation, and hence the risk of stroke has gone up. So the key factors to remember is that all these risk factors, most of them, 80% of them, are modifiable by lifestyle, good lifestyle, getting a good diet. So we usually use DASH or Mediterranean diet, which is rich in fruits, vegetables, nuts, less in fats and carbs. We must be more active, so about 150 minutes of moderate to high intensity exercise per week is recommended, about 30 minutes for 5 days a week. We must be conscious of our weight, don't have a lot of weight gain, sudden weight gains, even sudden increase or decrease of exercise. Like we see a lot of people getting into gyms without proper training or supervision. There is an abrupt, exercise patterns that they adopt. So I think all these things are modifiable, preventable, and will eventually lead to decreased risk in stroke.
Absolutely. And Dr. Asad, what are the things that a person should keep in mind if they are taking the medications for atrial fibrillation?
Right. The most important thing is to remember that these medicines are here to help you, protect you, and they are far, far more beneficial than their potential side effects could be. There is a lot of misconception in the society that once these medicines start, they will be going on for life. It's not the medications, it's the disease for which it is being given. If it is the diseases for life, as we had said, if AF is chronic, that means long term, you will have to take anticoagulation for life. Now, the first most important thing to watch out for when you're taking a blood thinner medication is bleeding. Now, bleeding is far, far less common as compared to the older anticoagulations or the older blood thinner medications which we all used to give, or our prior generations of cardiologists used to give. They have largely been supplanted by these newer generation oral anticoagulants, and they have been here, or they have come in simply because their efficacy is far more than the previous ones. While a patient cannot measure the efficacy because it's going to prevent a stroke, you can't measure that. You can watch out for things which can increase your risk of bleeding. Now, if you already have a bleeding problem, you can talk to your doctor, you can discuss, should I take it, should I not take it? If I can take it, what is the dose? There are several dose modifying steps that we can do. For example, if a patient is more than 80 years, his creatinine, that is kidney, is down, his weight is too less, or he has had a prior history of bleeding, then there are certain things we do to reduce the dose of the blood thinners.
And Dr. Anil, are there any complications also that occur with atrial fibrillation or with these kind of medications?
Yes, so I think that's very important question, because as we have been discussing that atrial fibrillation can lead to symptoms like palpitations, but it can also lead to overall reduction in the heart function. We call something that we call heart failure, if the heart rate remains very high for a long time, that can lead to heart failure, which basically means that the heart reduces its pumping ability. The second complication that we have already talked about is a stroke. So these are the important complications. And as we have been listening that it's a chronic ailment. So it persists. If once it develops, it is hard to totally eliminate it. We have to manage it an entire life. So what is important is from the general public's point of view is to prevent it at every cost. So in all cardiovascular diseases, in fact in all diseases for that matter, prevention, as we say, is better than cure. So one has to follow a heart healthy lifestyle, control all the risk factors proactively like blood pressure, diabetes, and other like avoid certain foods, alcohol, smoking and all that.
Dr. Vinayak, if a person feels palpitations, what does a person do in that situation, in that very moment?
That's a great question, because I think it's very important to understand when should you actually take action on something which you're feeling. So if you find very frequent palpitations or prolonged palpitations which are lasting for many seconds or even minutes, where you feel dizzy, you get breathless during these palpitations where there is a fast heartbeat which you're feeling, which is coming and going or is irregular, sometimes you can feel that. I think that's the time when you must go to your general practitioner, the GP, or a local private practitioner, at least get an ECG done.
Dr. Anil, these days it's a trend to wear these fitness watches and where you can monitor your heart rate. So how effective is this?
So that's a very interesting question, because we call them wearables, and there are a lot of devices which can monitor heart rhythm, including most common is of course a watch, but there are wristbands, there are t-shirts, there are pendants, they can all monitor heart rhythm, can record and can analyze also. And now increasingly more and more intelligence is being built into them, and many of them can very accurately diagnose atrial fibrillation, particularly watches. These can be very useful in certain patients where we are suspecting heart rhythm disorders. But there is a counter side to it also, because in many patients they cause unnecessary anxiety because there are false positives and they keep looking at their heart rhythm. Sometimes they can pick up the noise, they can pick up body movements as heart rhythm disorder. So a confirmation by a physician is very necessary whenever we use these devices. But certainly they are developing, they are something in evolution, and it is quite possible that in future they may play increasing role in early detection of atrial fibrillation, so that patients can then be directed to proper medical care.
And another question that is just coming to my mind, if a person does not have any heart diseases, can atrial fibrillation still happen to that person?
Yes, it can. So we call it lone atrial fibrillation, that even otherwise healthy person with an apparently normal heart can develop a purely electrical disorder in the heart. So that's called lone fibrillation. It is comparatively safer if detected early and managed. The management is also easier, and the success of treatment is greater in this particular subset, and the chances of stroke are also less in lone atrial fibrillation. It's very important, like all diseases, to prevent atrial fibrillation, and for that a heart healthy lifestyle should be adopted by most people.
Dr. Vinayak?
So I just want to end by saying that the 50% of worldwide deaths are due to cardiovascular diseases, which we basically say as myocardial infarction, heart attacks and strokes. And the commonest cause of strokes is atrial fibrillation. But nobody really talks about atrial fibrillation, while we know that people are dying, and the kind of disability which a stroke gives you is unparalleled by any other disease. So I think it's time that the public awareness about stroke grows, about atrial fibrillation grows, because it's a preventable disability and death.
Absolutely. Dr. Gera?
Dr. Vinayak rightly said that awareness is basically main aim of this campaign, and we should be organizing more of such events, and it should be better that we call all those atrial fibrillation patients who had experienced complications of atrial fibrillation, and we have one-to-one interaction with those patients to look at bleeding complications with blood thinners. So the risk, I would like to just comment in the end that the benefits of using blood thinners are far more then its complications. So we should be prescribing blood thinners to every stroke patient or who had atrial fibrillation with stroke and other complications.
Well, thank you so much, doctors, for taking out the time and for this very informative discussion. I'm sure your expert advices will come in handy to our viewers. Well, I'm sure you've learned a lot about this very serious heart condition, and the expert advices given by the doctors will always come in handy. With that, it's an end of our special show, Listen to Your Heartbeat. Thanks for tuning in.